Hey guys, this is Dr. Hub. Now let's look at the familial versus the constitutional short stature. So to begin with, we are looking at the constitutional short stature. So here, how is the height? The height is short. So how is the final height? The FH, the final height, is going to be normal. And in case of the history, the family history is going to be the delayed puberty. So there is going to be the delayed puberty. And what about the bone age? The bone age is going to be less than the chronological age. So this is going to be less than the chronologic age. Now let's look at the puberty. So in terms of puberty, it will be delayed. We can write it as delayed. And how about the height velocity? The height velocity is considered normal. So this was the constitutional. Now moving on to the familial. So under the familial, the height is short. Then when you look at the final height, this is also going to be short, whereas in terms of constitutional delay, it was normal. Then in terms of the family history, the family history has the short stature. The family history has the short stature. Next, all the others such as the bone age and the puberty. Next is the height velocity. So all this remains normal. Whereas bone age and constitutional delay was less than the chronological age and the puberty was delayed in constitutional delay. Whereas here everything is normal.